were one of the first hospitals to join the JCR Tracer program. We really were looking to make our labor-intense hard copy paper format become more efficient, more effective, and hopefully have some analytic purposes for reporting so that we could distribute the outcomes to our service line department chiefs so that they could drive their own performance improvement with the results from the tracers. As our health system grew very rapidly in the last 7 or 8 years, it helped us standardize practices, both inpatient and outpatient.
We identified with the Tracer program that we had an opportunity to create different forms and evaluations of staff knowledge, of clinical knowledge and ability to really address patient safety issues in a systematic way throughout the organization.
The JCR Tracer product allowed us the flexibility to make it work for our rehabilitation services. We have very different needs than a lot of the other departments in the hospital, including in environment of care, in the way we document, and it allowed us to do a crosswalk with CMS and JCR standards and focus on therapy-specific requirements.
Because there's very specific criteria related to medications, the great thing about the Tracer tool is we were able to create our own form, our own medication management tracer form. So this allows us to, from a system-wide perspective, look at data and trends, implement changes, and monitor those changes for system-wide compliance.
When you're looking at the citations and comparing NYU Langone Health to other organizations in the nation, our citation levels are much lower. So what we're able to identify using the Tracer tool, self-identify, self-correct, it's helped us make sure that across the system, teams know what to do and how to do it.
Because our interviews and our tracers reach all staff members, whether you are a physician, whether you are building services, whether you work in transport or a laboratory. No matter your role as an employee of the medical center, in some capacity, you're going to experience a tracer. The Tracer tools helped us get policies, procedures, staff knowledge, practice to where it needed to be at our level for patient safety, quality, and outcomes. There's a tremendous amount of value in the program. There's been a lot of work done by Joint Commission resources to listen to their end users and provide any updates and make any updates possible to the program. So I think it's a good support from Joint Commission resources.